The introduction. So this meeting will be recorded. We just started it. And I have a couple students from UCLA with me today to give you an insight on what our life is like during COVID, maybe before, and our journeys so far in medical school. So we have our MS1. Can you show your photo and introduce yourself?
Hi everyone, my name is Juhi Agarwal and my pronouns are she, her, and hers. I'm a first-year medical student at UCLA, originally from Birmingham, Alabama, just graduated from the University of Alabama at Birmingham, and now starting my first year at UCLA Medical School.
Thanks. And I'm going to be the person speaking about the MS2 class. I'm Christina. I am from Maryland and I took a gap year. So if anyone has any questions about that later or need to email me, I can talk about that. And I went to University of Michigan.
Hello, good evening, everyone. My name is Fitzgerald Diala. I am a third year med student currently. I am in the MD PhD program. I attended UC Riverside where I studied biochemistry. I moved to UCLA after 1 year, one gap year. And then I just recently completed my PhD after some time, and I have joined the third year class.
Great, thank you so much. And then we actually have two MS4s that can speak today.
Hi everyone, my name is Methma. I'm originally from Missouri. I went to Brown for undergrad and I did also take a gap year, so I'm happy to talk about that. I did research at the NIH and right now I'm applying to neurology residency program.
How's it going? My name is Boris. I am from Fresno, California. I went to CSU Fresno or Fresno State for undergrad. I did not take a gap year, so if anyone's interested in that, I can talk about that as well. I'm currently in Methma's class, MS4, but I'm in the prime program here, which is a 5-year dual degree program. So I'm taking a leave of absence and pursuing a master's in public health with emphasis in epidemiology this year. And then after that, I'll be coming back to finish my last year of medical school and then most likely apply into emergency medicine.
Awesome. Thank you so much, everyone, for introducing yourself. So the way things are going to go tonight are we're going to start by going through each class, MS1 to 4, and we'll just talk a little bit about what a day in the life is like for us. And we have about 10 minutes per class, and then we can also just chime in, upperclassmen, to compare, contrast how our MS1 or MS2 year was similar or different. And then we'll close out the last 10 minutes with any last questions, and we can always loop around if anyone has anything else. So to start, Juhi, can you talk about what is life like for you as an MS1? I know it is a little different because it's COVID from the rest of us.
Sure, I can get us started. So because of the pandemic, most of my classes are online and some of the afternoon labs that I would be having, but we do have some in-person activities still. So I can kind of give an overview of like a day in my life and then change that for some days when we have other activities. But every day, typically, we have lectures from like lectures in the morning, 2 lectures usually, and they are over Zoom and you can go to them live, but you don't have to go to them. Like attendance is optional as long as you get that information at some point and really learn the material. So the first block of medical school, I didn't really go to lectures live, but now I've begun to because I like having more of a structured schedule in doing that. So I'll typically go to my lectures in the morning and then have lunch. And usually there is an interest group meeting around lunchtime, like around noon. And there are various interest groups that our class has for different types of specialties in medicine or different areas of interest like public health and other things that you can maybe aren't like a specific specialty, but other things that you can learn more about and get involved with. And those are also on Zoom right now, so I can have that on and enjoy my lunch from the comfort of my home. And then in the afternoon, it depends on the day, but I'll either have a free afternoon where I will usually study, or since the weather is typically really nice in Los Angeles, go outside for a walk or a run, or study outside. And if I have an afternoon session, then I will go on campus for that. I have a class called histology where we look at different tissues and we learn about what tissue is typically supposed to look like and what tissue of different diseases looks like, and trying to tell the differences. And we look at microscopic slides for this that are blown up so you can see them really well on the computer. And I have anatomy lab that's going to be, I have it at some weeks I have it, some weeks I don't, but we go into a lab and look at cadavers and identify different structures, which is something I've never done before and has been really interesting. And on some days I have a class where I learn different parts of the physical exam. And so some parts we can't do because of COVID, like looking at the nose or looking in the mouth, but we can still take blood pressure, listen to the lungs, use a stethoscope and things like that. So I didn't come into medical school with a lot of clinical experience, so a lot of that aspect is very new to me. And it's been really nice learning those different set of skills from that. And then in the evening, I may study a little bit more by reviewing my notes or trying to make diagrams of different processes to understand things better, and then have dinner. And usually I cut off studying into like at some point in the evening. I don't really like studying super late. So then I'll like watch some YouTube videos and go to bed. And then on the weekends, I like to spend time outside. There's of course limited things you can do during the pandemic, but it's been nice to go on hikes, go to the beach, and just spend time outside hammocking and enjoying the weather. So that's pretty much what my schedule looks like right now. But I would be interested to hear from our other panelists how their MS1 year looked like compared to mine.
Yeah, mine was actually like kind of half and half with you because COVID started in March of this year. So that was the second half of my first year. So we had anatomy and everything in person and all the histo labs. And then we transitioned to online. At first I actually kind of liked it because I thought the labs were very tiring in the afternoon after lunch. But I think that I agree. First year is very lecture based, and I'm glad I went to I listened to all of them, because I think by second year, when the shift of your focus is more on your board exams, I think our school does like a really good job of setting a good foundation. If any of the upperclassmen has anything to say about that.
I think the only thing I would add is, in addition to like all the lectures and afternoon labs, during first year and second year, there's this component called problem-based learning where you're grouped into like smaller groups of maybe like 8 or so classmates, and with one professor or tutor, like a senior medical student, like a fourth year or something like that. And you meet on Monday morning and you start discussing a case, like a patient presenting with a specific problem. And it's related to the topic that's going to be covered throughout the lectures that week. So you start kind of building that foundation of how you would approach a problem. Then throughout the week, you learn all the material that's relevant to that case throughout the lecture. And then on Friday, you meet again and then kind of wrap up the case and discuss what you've learned. It's a really interesting way to kind of start thinking about everything you're learning in a more clinical approach. And it's also fun to collaborate with your classmates and solve problems and puzzles along the way.
Awesome. So transitioning to the second year, I think the biggest difference between the first and second year is that your focus kind of shifts onto your board exam a little more. But in your first and second year, you're still taking, you're still listening to lectures every day. So you're not in the hospital as much. I think the majority of my class listened to most of the lectures first year. And then by the second year, people kind of figure out their own study method. So my typical day is waking up and I always work out every day because I think, especially during COVID, I really need something to like keep me grounded, especially because I'm inside all day just studying. And I think the stress of like board exams is getting closer and closer every day. But I think when you guys apply to medical school, it should be pass fail. I know Juhi's class is pass fail for the first board exam, which is nice. So I listen to lectures that from outside resources that align with our schools, and I review notes from our school material. And we also have similar clinical skills classes as the first year, except they kind of build on that just to really hone in on those skills before we start our third year. So we're comfortable, doing a physical exam. We also still have a class called doctoring where we learn how to interview patients. So first year, they kind of give us very basic cases. And then by the second year, they give us more difficult cases where patients, could be very emotional, or like they also help us learn about how to deal with patients dealing with homelessness or mental illness, things that would be a little more difficult to learn in the first year. So I think second year, they're really just trying to prepare us for third year when we're in the hospital working with real people, not only patients, but attending physicians and residents. And so to do that, we actually do have a couple class times we can go in the hospital where it's called preceptorship. So we have that first year, but then second year, you're able to pick your doctor, like who you want to work with more readily. So this year I wanted to be in the hospital more rather than being in a private practice outside in the community. So I'm at Santa Monica with a hospitalist, which is an internal medicine doctor. So I kind of see a little bit of everything where I'm able to take like a full patient history and see all the different pathologies, which I really enjoy. The only thing is that last week they canceled it because COVID is just getting really bad in LA, but that should resume in January. And then if anyone has any questions as well, you can put it in the Q&A and we can always jump in and answer it or type a response to you guys.
Anyone else want to add something to the MS2? So in addition to what has already been stated in the first and second year, I think I just remember being like, oh, it's kind of like playing house, like the show. I don't know if that's too much of an old show, but yeah, so like the PBL is kind of like house. So that was pretty cool. And so for me personally, after the second year, I think something that people usually do is that they also shadow in addition to the preceptorships that people have. I personally didn't because I was like, oh, I'm going to have all this time during my PhD to shadow. And of course I did. No, I didn't. I didn't shadow anyone because, I was in a different phase of thinking. I enjoyed being in the lab. But what I did have the time to do was to begin to develop a thought of what I thought my specialty of interest would be. And I think I landed on ophthalmology based on circumstances and thinking about vision being very important. So what I have done this third year is I am learning how to study. So what happens in third year is, you come in, go through different clerkships, as they're called. People have different names that they call them: rotations, clerkships, a bunch of different things. The wards is the classic terminology that people use for them. So at UCLA, we have 8 different ones. 4 of them are 4 weeks each. You don't have to know what they are. 2 of them are 6 weeks each. One of them is 8 weeks, and the biggest of them is 12 weeks long, and that's surgery. So I started on pediatrics and OB-GYN, and during the beginning of COVID, we weren't sure if we were going to have enough PPEs for students to be able to be in the clinical setting. So UCLA had to kind of build a 6-week buffered period during which time they came up with different Zoom lectures for us. So they didn't really know. So it was kind of like winging it, which is pretty cool. So I had 3 weeks of pediatrics. So, we learned about acute otitis media. So we just got lectures and beginning to kind of think about cases, learning things in that perspective where, you have information, a STEM about a patient, and then you try to figure out what is going on and learn about that disease process and all that. And so I did that for pediatrics, and then I did that for OB-GYN, and then they had some idea that the different hospitals were going to have enough PPE so that when the patients, because we're about to get 180 students join different clinical settings, they knew that they had enough. And so what happens is I wake up, depending on the specialty, right? If it's pediatrics, I think the earliest that I had to ever be there was like 6:30 versus like maybe my OB-GYN rotation. I think I had to be there sometimes around maybe 5:30 or something. And the reason is because, things that are surgical tend to start really early in the morning. So what happens in that is, I come into the wards. There's a patient that I was assigned to, and I check on that patient. I ask the nurse that saw that patient the night before, what happened. And then I start to build an idea of, okay, nothing, acutely happened overnight, or something did. And then I go and I talk to the patient, I examine the patient, and I take that information and I present it to my group. But before I do that, I usually talk to either the intern or the resident that I'm working with. I say, hey, okay, I talked to the patient, I did a brief exam. So the clinical skills that we build in the first and second year where, we're examining each other, which everyone is pretty healthy, right? Now you begin to kind of examine a patient, depending on what it is that their issue is, right? You examine them to make sure that they're fine. And if they're not fine, you find out what's wrong. And then you kind of begin to build an idea of what might be happening. And then we have rounds where I give that presentation, like there's a patient, it's a 39-year-old who, just gave birth or whatever the presenting case was. And then each of the residents or any other medical student presents their case, presents the patient, and the attendants or the senior medical student kind of like, not medical student, senior resident, this, everyone kind of figures out what it is that we're going to do for that patient for that day, right? Are we going to, keep things as stable, change new medication, discharge them home because they're finally healed and all that kind of stuff. And so that kind of happens. So like in the surgery, and when I was in my surgery rotation, same things happened, except, then we have new cases, right? I go to the OR, I observe an operation, they're asking me questions about anatomy, right? So that means that at night or when I am not in the OR, I'm relearning the anatomy to make sure that I know what's happening, that I'm engaged. Things look different than they look in books and things like that, but it's generally, more engaged and, learning how it is that an operation is done, not because I will necessarily do it, but like seeing how that ends up happening and kind of different decisions that the surgeon is making, right? For example, we had this really big kidney that we wanted to take out laparoscopically, and we're cutting through, and it was a big kidney tumor, and the anatomy looked very different than the CT, right? The CT, like it's really good, but like nothing is gonna be the same as seeing the anatomy. Everything looks very different. And I think it's sort of like an appreciation that comes from the rotation. And so we had to convert from using the robot to kind of like having an open operation. And that just, so kind of seeing the different decision that the leading surgeon was making, and kind of like ultimately how that factors into, like a surgical career or urology, whatever it is, right? That was what I got out of that experience. And in terms of when I'm not in the wards, so the time that I'm in the wards, right, it depends on what rotation it is. So from surgery, it's like 4 something, I wake up around 4 something, depending on where I have to go. And then I go to bed maybe somewhere between midnight and whatever. And then after that, I come home, usually around 6, 7, 8, depending on how long the day is. I eat, and then I try to study, right? I look at what cases did we see that day, what was interesting, what questions did I get that I didn't know the answers to. So I looked that up and I learned something about it. And then we have standardized exams that we take during the 3rd year, and they're called shelf. You need not know anything about it, but we all have to, in the clinical years, study for them. And it's kind of like a way of standardizing what it is that what you're expected to have learned. And so that's what I do. And that's how 3rd year is going. But I love it a great deal. It's different from research, but it's its own different thing. But yeah.
Awesome. Thanks so much for sharing that. I know 3rd year is very busy, I heard. So I'm looking forward to it. We have 2 MS4s. Mathma, can you go first? And then Boris, can you go second?
Yeah, so I'm an MS4, and an MS4 year is a great year of medical school because you have a lot more control and flexibility over your schedule. So a lot of students use that time to do rotations in whatever they're really interested in, and also to do kind of like last chance ever rotations. So I'm going into neurology next year, and as a result, basically almost all of this school year, I've gotten to do neuro-related things. Like I did inpatient neurology at UCLA and at Cedars, and I did some outpatient neuro in Santa Monica. I did a neuro rehab rotation at Cal Rehab, and I did a neuroradiology rotation with this really amazing neuroradiologist, which was a rotation that I just made up because I wanted to learn from her. We really only have one strict requirement for 4th year, and that's that we have to do an ICU rotation. And then in addition to that, there's a certain number of weeks that we need to fill with clinical activities. But outside of that, you can do whatever you want. So I'm doing my ICU rotation in the winter in January when we get back. And I'm also doing an East-West medicine rotation that I think will be really interesting, and also child psych, just because it's something that I think is interesting and I'll probably never get ever again. But right now, in terms of a day in the life, it's kind of odd because I'm off of rotations just for residency interviews. So if you want to know my schedule, I wake up between 4 a.m. and 7 a.m., depending on which coast my Zoom interview is on. And so I get ready and put on my blazer and sit in my bedroom and do Zoom interviews all day. So it's a really odd year. And hopefully by the time you guys are all here, you'll be able to travel and actually get to know places and talk to people. But there are definitely pros of all my interviews being on Zoom in terms of saving a lot of money on travel, and it makes it for a little bit more equity in terms of whether people can afford to take interviews or not. And then the rest of the year, in terms of what I do in the hospital, it's pretty similar to what Fitzgerald was saying about being a MS3. As an MS4, you usually get to take on a few more patients, I would say. And I also think it's the responsibility of the MS4 to help like onboard MS3s onto each rotation. And try and teach as much as you can. I always like to go over the neuro exam if I have MS3s on rotation with me. So you get some ownership over your patients, but I think that starts as an MS3, especially here. I think our residents are really great in letting you come up with plans that you then run by them. There are, of course, a lot of levels for patient safety, like a lot of levels of oversight, but I really felt like from MS3 onwards that my patients were really my patients and I was deciding what to do for them. And obviously all my decisions were checked many times over. And outside of that, I am also a tutor. I tutor first year medical students on Zoom now, which is also an interesting experience. I'm a head tutor, so I lead this project on mentoring and teaching new tutors about how to teach. I'm also a medical education committee representative, which means that I represent my class in certain decisions made regarding our curriculum. And some other things that I like to do are I like to hike and to bake and to eat with my friends, although I don't get to do that anymore because of COVID. And then to answer a couple of the questions in the chat, I agree that in my first 2 years of med school, I would see my friends every day. And then even on third year, I'd probably see my friends once a week. But since COVID, it's been not really ever in person. Sometimes we like exchange food and drop it off at a door. And I really, really love neurology clinics. So that's what I would really look forward to when I was a third year. I think it's a really fortunate place that we get to be in where so many patients will share all of these really powerful and unique and intimate stories with us. And I like being the one who gets to listen to that.
So I can add a little bit to that. So as I mentioned, I'm currently in my leave of absence year, completing a master's in public health as part of the PRIME program, the dual degree program here at UCLA. So I had the opportunity to also do a few fourth year rotations before starting my MPH in September here. So as mentioned, I'm most likely going into emergency medicine. So I did the ICU rotation, like Methel mentioned, and a few of those emergency medicine rotations. And it is really cool as a fourth year, more is expected of you on the clinical rotation, but you do have the sense of like you do have even more ownership over your patients and like the decisions that you're making. And you do have the opportunity to interact with third year medical students and teach a lot and try to make their lives a little bit more enjoyable and less stressful than what you experienced when you were a third year. So that part's a lot of fun. Now, since September, I haven't been in the hospital anymore. Just if it wasn't COVID, I would be going to campus and going to classes for my master's, but now it's all via Zoom as everybody is experiencing, unfortunately. But in addition to doing like MPH classes, been doing a lot of additional like research projects, some COVID related, some like emergency medicine and trauma related, which is a lot of fun. So during your master's year, you do have more time to get involved with some extracurricular activities, such as research if you're interested in that. Similar to METHMA, I also am a tutor and part of like a medical education fellowship as well, just learning how to become a better instructor and teacher for both for like lectures, but also for clinical skills and stuff like that. And I also get to teach the small group activities as well, such as problem-based learning and doctoring, which is a lot of fun. Other than that, I see a few questions that popped up asking about how long each rotation is. So that is, each medical school kind of determines how long each rotation is going to last. Here, they range from 4 weeks being the shortest to 12 weeks being the longest, but that is med school dependent, and it can change from year to year. It kind of depends on the situation. And then I see a question about what we really enjoy specifically about DGSOM. Honestly, I couldn't be happier being here. It's been the best 3.5 years of my like education in my life. Every day has been a pleasure, and it makes it really easy to wake up early in the morning and go to like lecture during your first 2 years when you have such amazing classmates and like amazing professors that are really passionate about teaching you and passionate about serving the community. And then like third year and fourth year just get better and better because you get to apply that information that you learned and that passion that you've kind of been like just like stewing in that excitement of like trying to learn something to be able to help somebody, and you get to see and like learn from patients and get to hopefully have like amazing interactions and make a difference and kind of finally get to do what you've been really wanting to do for like years and years. So every moment's been like truly a blessing. Like I can't say like any day's been a bad day since I've been here. So
I think what's really cool about DGSOM too is that it seems like the administration really listens to us. Like any concern we have, whether professional or personal, they're always there to listen and they respect us, kind of like equals, which is really nice. I know some of my friends, other schools say that like, administration really doesn't change, they don't listen to their students, but it seems like here they really do respect us. And I think that's why I really like this school, is because it really does seem like a community, not only with administration, but with like upperclassmen as well. That like if I want to reach out to anyone, I'm able to. So that's why I really like this school.
I think another huge plus to DGSOM is the wealth and breadth of clinical sites that we get to rotate at. Especially now that I've been doing residency interviews, it is such a gift that we have, Reagan as a tertiary quaternary center, and all of you, and Harbor in terms of county options, and Cedars, which is run totally differently, as well as the VA and the Kaiser system, to really learn in different environments with very different patient populations and very different amounts of resources, both for you as a future physician and for your patients. And it's so, so valuable to get to see all of those different ways to practice medicine, as well as to be able to work with all those different types of patients.
Yeah, just echo what Methma said, like that diversity of clinical exposure is incredible. I made it a point during third year to try to rotate at every single site like differently. Some classmates prefer to stay at one site for like continuity and get kind of used to the system, or just ease of access if it's close by. But I really tried to go to every single site, which resulted in a lot of driving and a lot of traffic and long days. But I think at the end of the day, it was worth it. That exposure, you can't get that anywhere else. UCLA is really unique for that.
I second that. The driving is very much worth it.
Yeah, I guess I'll say that and then address the next question. I mean, like I think where you train and what you do affects the kind of medicine you end up practicing, and I'm sure the upperclassmen can second that. So I've enjoyed being able to be in different places. I've been frustrated by different things, and the frustration has to do with, as you learn more, like in your mind, it's very easy. You're like, oh, patient is sick, heal the patient. And then as you learn more about like, well, you got to heal the patient this way with this insurance or that insurance. And then those kinds of things, you learn those things. They're interesting things to come to learn about the process. During my gap year, I worked for a program at UC Riverside. It was a mentorship program for students from disadvantaged backgrounds. So I did that for a year. With regards to would I recommend doing a gap year or not, I think you do what fits into your process, right? If you are like, I'm on track, I only want to just go forward, by all means do it. But for me personally, I had taken all my courses in college. I found that I hadn't taken the MCAT, and it was my senior year. And so that meant that I couldn't start medical school immediately. So I took the MCAT after graduating, and then I applied. I would recommend and if you have to take time to be ready, I think that's the most important thing. You continue to grow, and I think as you grow more, you're able to articulate better the things that are motivating you towards a career in medicine. I usually tell people that summer is not for classes, unless you are behind. right? If you're behind in school, right, you have to just make it up. But if you are on track, I think summer is the single best time to be able to, look into something else. If you ever were curious about doing research, apply to summer research programs. If you wanted to dedicate more time to volunteering within a clinical setting or what have you, I think that's what summer is for, because you have such an intense period of time during which to really, when you kind of like, you're like, oh, I'm going to volunteer in the lab, and you're there like sporadically every week, and you put in like 2 hours here and there, like you never really know what happens when it's not those 2 hours. I think if you end up putting something like 40 hours a week, you might be like, yeah, I dig that, or like, yeah, no, right? Those are things that you kind of figure out when you have the opportunity to have a more intensive experience with anything. And as it pertains to job and medical school, I mean, it depends on what job is, right? Like I had something that was offered, a position that was offered through the medical school. I suppose in a way it is a job, but like when you have to get another job that is completely unrelated to being a tutor or whatever, like administrations at most medical schools tend to dissuade students from doing that, because anything that you do that isn't adding to what it is that you're doing can really put a lot of pressure on the student and make it very difficult to be able to address those things. Those are my personal thoughts about it.
Yeah, I think regarding the working while in medical school, and Methman can add to this because we were both tutors as second year students, and then throughout the, as upperclassmen as well. Like that is a job and you do get paid, which is nice, but the hours are like very reasonable. It's not that, it's like 4 hours a week or something like that, 4 or 5 hours a week, and it's specifically designed to be doable and to like supplement your medical education and help you along the way. I personally don't know of anybody that was doing like have had an actual job outside of being like employed as like a medical school tutor, a medical student tutor. So I would say to not get a job while in medical school, I think it would be pretty almost impossible to do it, like balance everything well. And like if you're worried about finances, and sure, medical school is expensive, but there are like scholarships, there are loans, and don't be afraid of taking out loans. A lot of us are taking out loans and you're going to pay them back. Like having like a little side job isn't really going to offset that cost of medical school if that was like if that's the biggest concern. And I think it can come at the detriment of your learning and your overall enjoyment of medical school, because medical school is hard and stressful, but it's enjoyable as well. And I think adding like some extra side thing that's not related to your education is only going to make that process harder.
Additionally on that, if you aren't tutoring, a lot of students, I mean, almost everyone's going to be doing research as well. So you also have to take that into account, all the extracurriculars that you'll be involved in. For example, like all of us are in this extracurricular group, right? So like this is an hour of our evening that we're not doing other stuff. So like you'll be in like multiple different clubs, you'll be tutoring. It is a lot to work at the same time because you are building your resume and your activities just like in undergrad. And in addition to that, I know they talked about tutoring, on Zoom, but in your second year as well, you're able to tutor for anatomy. So that's what I do. I don't tutor like regular physiology lecture material. But I tutor anatomy. So I get to go into the lab with the students and we get to like put up session times, which it's really nice because you get to tutor when you want to tutor instead of someone telling you to. The only thing is that it's not paid, but it is considered service. So it's just a different avenue of like how you want to, serve your community and like the students. And it's a really nice review because then you don't have to study it later. Yeah.
The only thing I would add regarding this summer break question, and I agree that summer is a great time to do class related stuff. That being said, I did I did take summer's classes with the goal of finishing certain things to be able to free up a semester to be able to study abroad for a full semester while in college. And that was my goal. So like I, put in a lot of work over the summer to take like OChem and other stuff, and like had to do that for 2 summers. But then I was able to go to Costa Rica for a whole semester and like continue to study Spanish and take like biology classes for my major and do like a medical internship there for the entire semester and still apply without taking a gap year. So it's like doable. Like, were those summers like as like carefree? Definitely not, but like, that's like the price you pay if you wanted to do something for like the whole semester. And I thought it was worth it. So don't be like completely dissuaded. You just got to kind of balance it out and see what you want to do.
I can also share some of my answers to the question. So like I mentioned before, in my gap year, I did research at the NIH. I was looking at interactions between the nervous system and the immune system in mice, especially in the context of depression. And I highly recommend a gap year if you think that that's something that would be good for you. For me, it was a great time to take a break from school and to be able to live on my own and live out in the real world as someone who was working and not a student. And so I thought that was a really good perspective, but I also think that it's totally fine to go straight through from school to med school, and my friends who did that are doing just fine. And during a lot of my summer breaks in college, I did research because that's what I was interested in. But I also was a summer camp counselor for this STEM camp for middle schoolers, which was really fun. I made sure to go home and see my parents. During my first summer in college, I did a little bit of research, but also worked this retail job that I'd had as a high schooler. So I really think that you can make your summers work for you depending on what you like to do and also what you have time for. And then I also think that there's no way I could have had a real job during med school. So I second what everyone else said about the job.
I also did the NIH in my gap year, like Methma. I thought it was really great because it kind of sets you up to med school, and I think it's a really good experience before med school. People love that. They ask you about it all the time because NIH is just a really good program where you're able to meet other students, apply to med school, dental school, PhD, and you get to learn about what they do. I think that was the first time I felt like I was part of a professional community, like science community. Because in college, it's a lot different being a student rather than being a research fellow kind of. So that was really cool, and seeing where other students went to med school or professional school. And also because of that, I realized I didn't want to do bench work, and then I could focus on what I wanted to do in med school, what kind of research I wanted to do. And I think that you will really figure that out by just doing many different experiences. That's when you'll kind of figure out what you like to do. So if anyone has any questions about that, you can email me about it. I've talked to a lot of students about the NIH program because I think it is really good and it pays you well compared to other gap year programs.
I'm also happy to talk about the NIH program to anyone who wants to and may be interested in neuroscience research. And to answer one of the questions, it's usually 1 or 2 years. I knew that I wanted to apply to med school during that year, so I chose to do 1, but I have plenty of friends who I met there who were on their 2nd year. And I think that there are a lot of additional pluses to being at the NIH in terms of just having such a wealth of research labs in such a small space. It's just there are a lot of talks that you can go to and a lot of people that you can meet. And that was one of the pros of being at the NIH in comparison to just staying at my undergraduate lab.
What's cool about the NIH too is that because it's actually in your contract that you have to do a graduate program in, some health science or PhD, they give you time to interview, which other jobs might not be able, they might not give you that time. So, losing time or doing request days, the more interviews you have, you just go to it, and your PI is always supportive of it.
Yeah,
Just
they're
very
very
nice.
supportive. And also they help you in terms of interview prep. Like we did some mock interviews and then I had this interviewing group that I would meet with every week. And I think we just sit around at lunch and we'd like do practice interview questions together because we'd met at the interview prep. And then I made all these friends who were also applying to med school all around the country, which was really cool. And it's been cool to see how their experiences have been at the different places that they ended up. And then one other thing that I wanted to say was I did the Amgen Scholars Program as one of my summer research options, and I really, really liked it. It's basically funding for research at something like 10 to 15 different universities around the country. And they help you find a mentor at the university and they help you get set up with research. And you get to come to UCLA for the Amgen conference at the end of the summer, which is really fun. And I think it's a great program if people are looking for summer research opportunities in the future.
I just saw a question that I'm like super excited to answer because I'm really passionate about. Somebody asked what the types of opportunities are able to study abroad during med school. I was really big into global health as an undergrad. Studied abroad in Costa Rica, did like some field work in Fiji as an undergrad. And then in med school, I did between first year and second year, most students do some sort of summer research project. I did a global health research project in Guatemala where I spent seven weeks there investigating like barriers to access of surgical care for kids with neurocongenital disorders, spina bifida. So I got to live in Guatemala City for 7 weeks doing this research project and got to shadow and do like a lot of cool OR and hands-on stuff, which was a lot of fun. So there's that opportunity between first year and second year, that summer, you can do global health work. In addition to that, some students that take a leave of absence. I was considering doing my master's internationally. There's that option. There's also the option of doing certain fellowship programs to do research in certain parts of the world. A lot of people go to Peru as a common one to just continue doing this HIV project. There's that option as well. You can also, again, I was considering doing my MPH in global health at Hopkins and Harvard before COVID happened. And then when they like shut everything down and it was all going to be online and couldn't do any of like the field work in Africa, then I was like, well, I'm not going to just do that. I'm not going to not participate in that. So I decided to stay here. So you're also, as a fourth year, then you have the opportunity to do international rotations in the second half of fourth year, usually in Mozambique, Vietnam, I think South Africa. I might be missing a few more. Again, unfortunately, those are all on pause now with COVID, but that's like another amazing opportunity that UCLA offers to its students. UCLA has a really big center for global health here, and so there's a lot of cool research opportunities and then also a lot of cool clinical opportunities as well. So if people are interested in anything about that, like I'm pretty involved and I'm more than happy to talk about it more.
Awesome. So it is 7:53. This is until 8 o'clock. So we have a few minutes left. If anyone has any questions, you can put it in the chat, as well as any of the panelists. If you have anything else you want to, add in, so people can kind of get an idea of what, what life is like. Maybe everyone can talk about what is one thing you really enjoyed about your current year and what is something very stressful about your current year. We can start with Juhi because she's a MS1.
Sure. So one thing that's really enjoyable is, like many of our panelists have said, our classmates are really supportive. And even in lectures and sessions that are over Zoom, if someone asks a question or asks for clarification or says like an answer for something in the chat box, we'll all put like, that was a great question, I had the same question, and like be really supportive that way. And it's really nice because we don't all know each other super well because we haven't all gotten to meet in person, but just the fact that we're all here and kind of like going through this pandemic together as an MS1 class is kind of like making us feel more connected and supporting each other, and just like sharing resources and ways to study and like different things that we create to help study, as well as just like encouragement and being honest with each other. Like we have a group chat, so sometimes someone will text and say like, is anyone as confused as I am about these lectures, or is anyone else feeling like this stressed? And oftentimes like most of us are feeling that way. So it's nice to have a community of people that are not competitive with you, but like supportive, and we're all on our own different paths, but we're all in this same path of medicine together, which is really nice. One thing that is stressful is not being able to have as much clinical experience in terms of shadowing and things like that. I remember as an undergraduate, it was difficult to find shadowing experiences before the pandemic, just in sending emails to doctors and not getting a whole lot of responses. And so I had heard that as a medical student, shadowing was a lot easier to schedule, and it could even be arranged for you through different interest groups, but that has been put on pause because of the pandemic. So I'm a little stressed about not getting to explore all of the different specialties that I may be interested in, because as our panelists were saying, the different rotations you go on in third or fourth year do not cover every single specialty. So I'll want to get more exposure, hopefully before the like after the pandemic ends, but before rotations, and see if there's shadowing I can do during that time. But I think it will all work out, and I've heard a lot of students don't figure out what specialty they want to pursue until they start clerkships anyway. So I think it will be okay.
So one thing I really like of my year so far is kind of similar to Juhi's. I think my class is just like very supportive of each other. I think that other schools, people talk about how it could be very competitive or like cutthroat, but I think at least in my class as well, people seem to be very collaborative. So I think it makes it a very nice environment where I don't feel like I'm competing with people, because I think that could be a super toxic, mindset, especially like being in medicine, where I think, everyone being pre-med, you do feel like I have to be the best in everything. I know like that's like kind of like the personality of a pre-med or even a med student. So I think initially in my first year, I was, kind of stressed out by that. But then I kind of realized by the second year that, if you kind of just reshift your thinking to just like enjoying what you're learning and not about the competition, and you just try your best and you'll be fine. I think every day just becomes so much more enjoyable and you really enjoy what you're learning more. So I think that is what makes me really happy about my class, and how that, changed from my first year as well. Um, and I think the thing that I struggle with the most, of course, is just like second year boards, but that's just kind of life. I think it's just got to study for it. Other than that, it does suck not seeing your friends, because, we used to see each other every single day in school. Like you wouldn't have to make an effort to see anyone. You would just see them and say like, hey, like let's study after this lab. But nowadays you have to like make a lot more effort. So that kind of sucks.
In terms of what I've enjoyed this year, I like patient care. I think I knew I liked it a great deal even before I came to it. I think there are different kinds of people who do MD PhD. I think I always was kind of like patients first was always my thinking, but I did enjoy doing research, and I still do enjoy it. What I've liked this year is kind of the opportunity to actually be integral in the care of the patients to whom I'm assigned. And it's kind of very interesting, like a patient comes in with some complex issue and you try to figure it out, you're learning, and then you're also trying to kind of learn along the way. So it's like the good part of it, right? That's the thing I enjoyed the most. And it's also like kind of challenging because sometimes the expectation is that you should already kind of, so as a human being to be like, oh, I don't know this and I should know this. And so that's kind of like the thing I'm wrestling with. And it's kind of like, I guess, on the other side of the coin, same coin, patient interaction and patient care. And so that's been my year.
I can go next. One thing that is stressful for fourth year is the countdown to March 19th, which is match day when I figure out my future. So that's kind of always looming, although interviewing for residency is super fun because you just get to meet people all across the country who like exactly what you like, and you talk to them about what you want to be and they'll help you become that, which is really exciting. And so that could be one thing, but also what I was thinking about that is a really good thing about fourth year is kind of like I said before, having so much flexibility over your schedule. I've been so happy these last couple months just doing constant brain stuff. And I just, it's a really terrific year because you get to do exactly what you want, which is really fun.
Yeah, just to add to that, I can't say that doing my MPH right now is really stressful. I mean, it's really enjoyable. It's a cool change of pace compared to med school. Like if you survived the first 3 years of med school, like doing a MPH or any like grad work is, I'm kind of coasting right now. It's nice, and you get to do all these extra things that you're passionate about. Like you get to pursue additional research that you're like really interested in, like do focus through like the public health lens, do extra teaching opportunities, you know, all these things. So it's been a cool change of pace, and I'm really excited to be able to apply some of the knowledge that I gained through the first 3 years into now public health work and trying to like implement certain policy changes and like projects, which is a lot of fun. So yeah, it's been a blast.
Awesome, guys. I think it is time now. So it's 8:01. Thank you so much for taking the time out of your evening to talk on the panel. I'm sure everyone really appreciates it. Good luck, everyone, on all of your different adventures this year. I know it's very challenging given COVID, but if anyone has any other questions, you can put it in our Q&A online. Let me just put in the mini link for you guys. And other than that, thank you so much for coming today. So I'm going to put in the tiny link right now.
I think a few people were interested in us sharing our emails potentially. So I'll put my email in the chat. So feel free to shoot me any questions if you have any.
I will put my email in the chat as well.